Johnson's Baby Oil Topical Emollients are used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. These emollients work by softening and moisturizing the skin, reducing itching and flaking. Some products are also used to protect the skin against irritation from wetness. Dry skin occurs when the upper layer of the skin loses water, and emollients/moisturizers work by forming an oily layer on the skin that traps water. Common emollients include petrolatum, lanolin, mineral oil and dimethicone. Humectants like glycerin, lecithin, and propylene glycol draw water into the outer layer of the skin. Johnson's Baby Oil Topical Emollients also contain ingredients that soften the top layer of skin cells and help the dead skin cells fall off, leaving the skin feeling smoother and softer. Make sure to use this product as directed, and some products may need to be primed before use. Always follow the directions on the product package. If you have any questions, don't hesitate to ask your doctor or pharmacist. Some products may need to be shaken well before use, so be sure to check the label. Apply the Johnson's Baby Oil Topical Emollients to the affected areas of the skin as needed or as directed on the label or by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use the product every time you wash your hands, applying it throughout the day. If you're using this product for diaper rash, make sure to clean the diaper area well before use and allow it to dry before applying the product. For those using this product to help treat radiation skin burns, it's important to check with radiation personnel to see if your brand can be applied before radiation therapy. Always follow all the directions on the label for proper use and apply only to the skin. Avoid sensitive areas such as your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise by the label or your doctor. Be sure to consult your doctor or pharmacist for more details. It's best to use this medication regularly to get the most benefit from it. Remember that most moisturizers need water to work well, so apply the product after bathing or showering while the skin is still damp. For very dry skin, your doctor may instruct you to soak the area before using the product. Keep in mind that long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. Using Johnson's Baby Oil as a topical emollient is generally safe and effective, with no serious side effects. However, some people may experience burning, stinging, redness, or irritation. If these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication, it means that the benefits outweigh the risk of side effects. Most people who use this medication do not experience any serious side effects. However, it's important to notify your doctor if you notice any unusual changes in your skin, such as turning white, soft, or soggy from too much wetness, or signs of a skin infection. While a severe allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not mentioned here, it's best to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Johnson's Baby Oil Topical Emollients, make sure to check with your doctor or pharmacist if you have any allergies or skin conditions, such as cuts, infections, or sores. Some ingredients in this product, like preservatives and fragrance, can make your skin more sensitive to the sun. It's important to read the label for any warnings and ask your doctor if you need to take special precautions when outdoors. If you have acne-prone skin, look for the word non-comedogenic on the label to avoid worsening breakouts. Additionally, some products may stain or discolor clothing, so be sure to ask your doctor for more details. If you are pregnant or breastfeeding, consult your doctor before using this product. And if you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using. It's important to be aware of potential drug interactions when using Johnson's Baby Oil Topical Emollients. These interactions could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important to consult with your doctor before starting, stopping, or changing the dosage of any medicines. If this product is swallowed, it could be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. When it comes to preventing dry skin, it's important to use lukewarm water instead of hot water when bathing, and to take baths or showers less frequently, such as every 1 to 2 days. Keeping baths or showers short and using a humidifier when the air is dry can also help. There are various types of emollient products on the market, including oils, creams, lotions, and sprays. Some may contain fragrance or other ingredients that could cause sensitivity in some individuals. It's best to consult with your doctor or pharmacist to determine which product may be most suitable for you. If you are using Johnson's Baby Oil Topical Emollients on a regular schedule and miss a dose, use it as soon as you remember. Do not use more product or use it more often than directed to catch up. Make sure to check the storage instructions on the package. If you have any questions about where to store it, ask your pharmacist. Keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flames, as it is under pressure. Do not puncture or burn the canister. Do not dispose of medications in the toilet or drain unless specifically instructed. Dispose of the product properly when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.